Hey, welcome everyone to today's Pineapple Support webinar on sexual challenges, root causes, and how to overcome them. Experiencing sexual challenges, either personally or professionally, can adversely impact one's overall well-being. This webinar will review the different types of sexual challenges, root causes of sexual challenges, and how to overcome them. Barriers to overcoming sexual challenges and how diverse sexual and relationship identities are uniquely impacted will also be covered. Today's webinar is presented by myself, Dr. Tess Kilwine. Let's get started. Some intentions for today's webinar, otherwise topics that we'll be covering: the different types of sexual challenges and what is often underlying these sexual challenges, root causes. Then we'll talk about strategies to overcome specific sexual challenges and barriers that people often face when overcoming these sexual challenges. As I always do with my webinars, is I'll be covering aspects of sexual challenges that are unique to the adult industry, as well as diverse identity considerations when navigating sexual challenges. And lastly, I will provide all attendees with a practical tool for overcoming sexual challenges in their own personal or professional lives. To start, we'll be discussing the different types of sexual disorders as outlined by the Diagnostic and Statistical Manual of Mental Disorders. While sexual challenges are experienced by all genders, these names on the slide typically apply to genitalia consistent with sex assigned at birth. The first three listed, of course, affect women assigned at birth, whereas the latter three affect men assigned at birth. However, it's really important to keep in mind that transgender and non-binary people who have had gender affirmation surgery or not might experience unique sexual challenges not exhaustively covered in this webinar. As far as sexual challenges faced by women assigned at birth, the first being female sexual interest or arousal disorder. So this is defined as absent or reduced interest in sex, thoughts or fantasies, initiation of sex, sexual excitement or pleasure, receptiveness to our partner's attempts to initiate sex, sexual erotic cues, or genital or non-genital sensation during sexual activities. This is the most common sexual challenge faced by women assigned at birth. Next is female orgasmic disorder, which entails marked delay in, initiation of, infrequency of, or absence of orgasm, or markedly reduced intensity of orgasmic sensations. Also a very common one. A lot of women that I work with share that they've never experienced an orgasm during penetration in particular, or never with another person. And so this is one that a lot of women face. And lastly, genitopelvic pain and penetration disorder. Now, this is a sexual challenge that's described as marked vaginal or pelvic pain, fear, anxiety about experiencing that pain, and tensing and tightening of pelvic muscles during attempted or actual vaginal penetration. So again, it can be that physical pain or the fear and anxiety of that pain that results in that tensing or tightening that then results in pain. So it's kind of a reinforcing disorder, in that you may experience pain once, and then that fear and anxiety might make your body respond in ways that actually promote more pain. Now on to sexual challenges faced by men assigned at birth. First being male hypoactive sexual desire disorder, which entails marked difficulty in obtaining or maintaining an erection, or marked decrease in erectile rigidity, this being the most common faced by men assigned at birth. Delayed ejaculation is the marked delay in frequency or absence of ejaculation. And then lastly, premature or early ejaculation involves persistent or recurrent patterns of ejaculation occurring during partnered sexual activity within typically around 1 minute following penetration, or before wished or before desired, right? So if someone's desiring to ejaculate within a minute, that wouldn't be a sexual challenge. It's more, before one wishes in a quick duration. So these are the type of sexual challenges. Of course, these are outlined by the DSM-5, the Diagnostic and Statistical Manual, but that doesn't mean you have to have a disorder or a condition or any kind of diagnosis in order to recognize that you're facing a sexual challenge and receive some support around that or seek some resources. Throughout this webinar, if you have any questions, please provide them in the chat and I'm happy to answer. Now that we've talked about the different types of sexual challenges, it's important to talk about what are some of the root causes. So sexual challenges stem from a combination of physical and or psychological factors, but they have consequences on psychological health, on our relationships, on our physical health. So it's usually a combination of multiple things. It's often not exclusively physical, though can be, or exclusively psychological, though certainly can be. It's often a unique combination of both that again become reinforcing over time. What we do know is that sometimes these sexual problems are actually embedded in relationship dynamics. They may be more present in a relationship. Maybe if someone has a history of abuse or trauma, or there's current problems in a relationship, you might be more likely to see these sexual challenges present themselves, but that's not required, right? So not everyone who experiences a sexual challenge is in a problematic relationship or in a dynamic that is challenging for them. So it can present at any time in any relationship dynamic. Because sexual challenges stem from a combination of these physical and psychological factors, it often requires treatment from multiple perspectives. So you may need some medical care, you may need some psychological services, or occupational therapy can be really productive in this kind of space. So it's not uncommon that someone will seek medical care and then not be able to fully understand the root cause or make any changes. That might mean, hey, let's add in a psychological perspective or vice versa. Ultimately, what's really important when trying to understand the sexual challenge that you faced is a thorough assessment of the problem, right? So who is impacted? What is the problem? Where does it occur? When does it occur? And how long has it been occurring for? Sometimes these challenges present in certain relationships and not others, at certain times and not others. So it's really important to understand all the dynamics at play. Equally important is assessing what is the level of the distress on the individual or the partner, right? So some sexual challenges are normal and faced by all couples at certain points, but what is the distress that that causes on that person or the couple? That might determine, how urgent is it that we get some support. History of the problem is really important, right? Is this problem new or pre-existing? Has it been present in other relationships? Did it come on suddenly or gradually? And does it also happen alone, right? When we're engaging in masturbation or only with partners? So those kind of history dynamics are really important. Relationships. So assessing again the relationship with the person that you're involved with or the people that you're involved with sexually or romantically. What are the strengths and weaknesses, the fears, the communication in those relationship dynamics that might be at play? Similarly, the level of affection and sensuality in our relationships, these are all factors that can impact sexual challenges. Communication skills is huge in romantic and sexual challenges. Is do the partners talk about sex before, during, after? Do they engage in giving, receiving, both? So really understanding what is the communication that's present in these dynamics that might actually be the cause or the underlying cause of a sexual challenge. It's also important to understand, are there other explanations outside the relationship that could be playing a role? So other presenting problems might be things like substance use, right? Substance use can impact our sexual activity, physical health challenges, history of trauma being a big one, infidelity in the relationship, lack of trust, things like that. So again, really important to get information about, the biological, the psychological, and the sexual health history of the person experiencing a sexual challenge. In terms of sexual history, some things that might be important are just the personal background. What is the current mental state? What is the medical history? Assessing the family of origin, right? Like, how do people talk about sex? What kind of sex education did you receive? Couple factors, marital factors. What is the role of masturbation and fantasy and dreams in that dynamic? Is it present at all? Not at all? Sexual experiences with others, that predate the current experience. What are the forms of contraceptive that are being used in the sexual dynamic that could be playing a role? Sex, money, history of sexual violence, sexual problems, other precipitating factors. All of these aspects of the sexual history are really important to understand, so we can get a full understanding of what the sexual challenge is and how to respond to it. As I mentioned, individual biological factors are really important. So, physical illnesses, medications, substance use, making sure that those factors maybe aren't the underlying cause of the issue. And then individual psychological factors. So like, what is the level of stress in someone's life? How are they coping? How are they thinking? Is there a history of trauma? All those things. Relationships, as I mentioned, is there anger? Is there resentment? Are there intimacy fears? How does the couple conflict manage? What are the power struggles at play? So really understanding the relationship dynamic and how that could be playing a role. And then equally important are intergenerational factors. Again, what are the messages that you or the person experiencing the sexual challenge have received about sexuality and stigma around sex, what it means to, communicate your needs in a sexual dynamic. The fear of disclosing, right? There is a sexual challenge or something going on. And, how is it normalized to express affection and in what ways? Then lastly, contextual elements are really important to understand for the root cause of sexual challenges. So, culture, how is sex positioned in that culture, within your religion, within your environment, within your overall values? So, cannot emphasize enough how important it is to really understand what the root causes of sexual challenges are. Often the thing that presents kind of in the front, the sexual challenge, we make assumptions about where that might be coming from. It's a personal fault, it's something in the relationship, but it often can be some unique combination of all of these factors that I've explained. Now we'll talk about overcoming sexual challenges. Of course, it's beyond the scope of this webinar to talk in full detail about all the different ways that we might overcome some sexual challenges, but I'm going to give just a couple recommendations. You might hear something that makes sense for you. You may be able to do more research on your own time, but what we have are really these evidence-based treatments for the different sexual challenges. So for sexual challenges faced by men assigned at birth, starting with male hypoactive sexual desire disorder, some things that you can do are, identify the physical issues, what might be going on physically, uncover additional sexual or psychological problems that we talked about. Often there is, a sexual or psychological problem underlining it, reducing response anxiety, doing cognitive work. So really like, what are the thoughts that come up in the sexual dynamic that may be playing a role? Working through affection and intimacy fears, if that's playing a role, uncovering any secrets that might be in the relationship or history in sexual engagement, providing general education, right? So it's not common when we receive sort of our standard sexual health education to talk about these sexual challenges and how they might present themselves. So providing general education, addressing relationship factors. So again, is this sexual challenge embedded within the context of that specific relationship, or is it a historic problem for you? Addressing those relationship factors if they're present. Then overcoming pessimism and skepticism about the role that, psychological services or relational services can provide in overcoming these challenges. And lastly, promoting communication between sexual partners, super crucial in any of these sexual challenges that we're talking about. Specific to erectile disorder, providing education here again is really important. Examining the thoughts, right? What are the ways that you're thinking about? What are the thoughts that come up during the sexual dynamic that might be, delaying your ability to achieve an erection? Working on performance anxiety is a big one for this one, especially in the adult industries. Are there thoughts about performance anxiety that come up that might be playing a role here? Understanding available medical treatments, substances that might be useful, just providing really good education on those avenues, and then assigning appropriate homework. So how might you over time engage in some work that helps promote, erectile that you want to achieve. And we will talk about one of those towards the end. It's called sensate focus, but one skill that can be useful for a lot of these challenges. Premature ejaculation and delayed ejaculation, understanding medical treatments that might be available if that is an underlying cause, providing psychoeducation about orgasm and does that always have to be the goal? Can we focus more on kind of that process and the outcome, and then sometimes the outcome is naturally achieved? Implementing behavioral strategies, so maybe different things like starting slow, starting stop, squeeze techniques, different things like that. So again, I think we have this assumption that just like penetration is the only way to achieve the outcomes we want, but different strategies like starting really slow, starting and then stopping, and different techniques can actually help this process. And then with the delayed ejaculation specifically, reducing just kind of like the anxiety that might come up here, using sensual touch experiences. So this might mean like foreplay or touching in different ways, and then exploring different forms of like masturbation, fantasies, things like that. So just some recommendations. Again, can't be exhaustive, can't talk about each of these in great detail, but just knowing that there are options available. Right, so overcoming sexual challenges for women. So now some different techniques, same thing, can't be exhaustive, but that might be helpful for overcoming sexual challenges faced by women assigned at birth. For female sexual interest and arousal disorder, again, kind of addressing just like pessimism and skepticism about sex in general and intimacy. These are not conversations that are totally normalized among women about talking about what are our goals. What do we want to seek out of our sexual experiences? So setting some realistic expectations, right? So maybe if your goal is like, I want to, have interest in and engage in sex every single day, that may not be a realistic goal for every person or every dynamic or couple or partnership. Taking off the burden of like being solely responsible for intimacy and arousal. That's a lot of pressure that women take on to themselves, examining the thoughts that they have around sexual interest and arousal. Communication skills, important for each of these, is how do you communicate some of those needs and those desires to your partner? How do you communicate, aspects of the relationship that might help promote sexual interest? Sexual fantasies, masturbation, things like that that can help promote sexual interest, and then using mindfulness. So, using different techniques to kind of slow your mind and get yourself present in the moment. Female orgasmic disorder, this is where we may look at some other medical therapies, right? We want to rule out other cause. We might explore barriers to orgasm. So what's really getting in the way, right? Is it thoughts? Is it pressure? What's going on there? And in that process might assign things like directed masturbation, right? Fantasy and erotica work, considerations about the partnership. What might your partner be able to do to help, with some of these disorders? And then home assignments. So again, part of sexual therapy is often focused on home assignments. There's only so much you can talk to your therapist about in the room. And so what are some different activities you might engage in at home? Lastly, for genital pelvic and pain penetration disorder, this is where we really do want to kind of do a medical assessment and see what might be going on. So assessing really what is the level of pain, at what points are those experiencing, and demystifying pain, like naming that pain as a part of this, right? And that, certain levels of pain we might want to overcome and approach, and certain levels may not be approachable, and understanding that there's room for all of that. Psychoeducation about the couple is really important of what, things might be going on in that dynamic. Establishing realistic goals is that certain levels of penetration may never be feasible for someone with genital pelvic pain or penetration disorder. Engaging in behavioral or cognitive strategies. So cognitive, again, the way that we think, is that fear and that anxiety of experiencing pain getting in the way of engaging in any level of intimacy? Or is it certain behaviors? Again, the assumption that if we're going to have sex, it has to require penetration, no consideration of other behaviors that might be, able to promote intimacy and arousal. Mindfulness-based treatments can be really helpful for this one as well. Again, staying present in the moment, and then medical treatment. So this is really the one that I often refer to occupational therapy. So you can engage in some of these medical treatments, different strategies for kind of promoting some relaxation in that moment. So great. Really the takeaway for overcoming these challenges, both for men assigned at birth and women assigned at birth, and then our trans and non-binary folks, is understanding that sexual challenges are a really unique experience to each individual. They require, different thoughts, different perspectives, both psychological and medical, and understanding that there's so many different options for approaching these, and only some of them are going to work for you, right? So we have these evidence-based treatments, but there's got to be a lot of different options or avenues to overcoming these challenges based on that unique person, based on that unique person's relationships. So having a lot of options for overcoming these challenges sounds really great, right? But that doesn't come without barriers as someone is, working to overcome their sexual challenges. So some common barriers that we might see in folks that are, experiencing these challenges and working to overcome them. The first being sexual ignorance. So this might just be like a lack of information on sex and intimacy, misinformation on sexual enjoyment and functioning. So, especially for women, a lot of women have not been told, like, you can prioritize your sexual arousal, you can prioritize your needs, you can communicate about concerns that you have. So sometimes these sexual challenges just come from general lack of information on sexual health in general. A lot of pressure on men in particular to perform in certain ways. And so demystifying that, performance may not always be the goal, right? Like simple intimacy and foreplay and different things like that can be a priority too. In line with that is sexual mythology. So these are just, misguided beliefs or misconceptions and distortions that really promote unrealistic expectations for sex. And so, we work in the adult entertainment industry, but that adult industry can often promote unrealistic expectations about what sex has to or should look like in our private lives and our private homes. So, really unrealistic expectations, the assumption that sex can only look one certain way, that everyone achieves orgasm in the same way, lots of misinformation about that. And sometimes these mythologies are derived from deeper aspects of like our culture, our religion, our family of origin. And so just understanding that sometimes the message we have received about sex and expectations for it don't make sense for everybody, right? They're not applicable to everyone. Psychoeducation, again, can kind of be a barrier here, is that the education that we've learned about sex and sexual intimacy, sometimes we have to unlearn and replace some of those thoughts and those beliefs. So again, the idea that like orgasm is the only goal from intimacy, that's something that a lot of couples have to unlearn. When you put all that pressure on yourself to achieve orgasm, it can actually make you less likely to achieve that outcome. And so unlearning and replacing some of these thoughts. And that goes along with these faulty cognitions. So this is, challenging the idea of like, what is normal sexuality? What is normal sex? What is a normal like goal or outcome we want from sex? And replacing that with things like enjoyment. It's okay to engage in sex simply for enjoyment and not for other purposes, not to achieve a specific outcome. Sexual guilt, anxiety, and shame is a big one that can come up and play a role in sexual challenges. So these are really emotions that restrict our ability to, express our sexual feelings and our behaviors and the challenges that we're having. And so looking at the emotional component and how that might be driving some of these sexual challenges. And then lastly, as we have alluded to, is intimacy fears, right? And so sometimes we're afraid to share that these sexual challenges are going on or start treatment because we might fail, right? So fears of things like rejection or abandonment from our sexual or romantic partners, dependency or codependency, anger, resentment, feelings of loss of control. So all of these kind of intimacy fears can show up when we're experiencing sexual challenges and then taking steps to overcome them. Right. As I always like to include a slide on sexual challenges unique to the adult industry. So this one's really unique, right? In that sexual challenges can show up in an adult entertainer's personal life, professional life, combination of both. And you may see it maybe in one space and not the other, right? In one dynamic with a person and not the other. So there has been a lot of research on how, watching porn affects sexual dysfunction, but less on how performers themselves are affected, right? And so the research that is out there is that the prevalence of erectile dysfunction among male adult entertainers is nearly 40%. So that's actually twice that of the general public. So our adult entertainers are more likely to experience erectile dysfunction in both their personal and professional lives at a greater rate than the general public. We find that this is most common among our young adult male performers around ages 20 to 29, and that 69% of our adult male entertainers do use erectile aids, things like pills and injections, and 58% of our performers need to use these pills both at work and at home, right? So again, these sexual challenges don't just present in one place, they might present in both and in different ways. Now, on the opposite side of that, the prevalence of sexual dysfunction among female adult entertainers, so this is the pain during sex, the low sex drive, the difficulty climaxing, is 26% among female performers, so less than that of the general public. It is more common among women 40 plus, and that's same as the general public, right? As we get older, we're more likely to experience sexual dysfunction. And then is actually more common among women with less satisfying personal sex lives, right? So if you're experiencing personal sex or romantic challenges in your life, those are more likely to present in a professional space as well. So ultimately, the takeaway is that our adult male performers tend to be more affected by sexual dysfunction, and our female adult entertainers tend to be less affected by sexual dysfunction. Doesn't mean that's going to be the same for everyone, right? So lots of women in the industry do experience sexual dysfunction, and it doesn't mean that all men in the industry experience sexual dysfunction. So really important to make that distinction. Some key takeaways for the industry, as I mentioned, is that these challenges may present in personal lives or personal relationships or professional encounters or both. And some performers describe relying on drugs, more, medications, injections, things like that to endure particularly long shooting scenes. I mean, what we have found is this can have long-term effects on the body, right? So things like painful, prolonged erections. We have seen, elevated rates of adult performers having to seek medical care for, painful, prolonged erections. And so it doesn't mean we shouldn't be using drugs and aids and things like that to endure scenes, but just, making sure you're checking in with a medical provider, making sure you're doing good assessment on how that's working for you. And the reality is, I think the main takeaway here is like the industry relies on healthy performers. That should be really, really our priority here is that this industry relies on performers that are psychologically and medically healthy and happy. And so the takeaway is we should normalize that this is a problem in the industry in the same way that it is, with folks outside of the industry. I think there's often this underlying assumption that, everyone in the industry is performing at really high levels in terms of sexuality. And that's not always the case, right? So, just because you see something on a screen or you're engaging in a behavior on the screen doesn't mean that that's the same or perfect in your personal life. So I'm really emphasizing and normalizing that this is a problem in the industry, just like it is for everybody else, and that help is available. So there are, medical treatments for this, there's sex therapy, there's occupational therapy, resources available for those in the adult industry that experience these concerns, and really highlights the importance of having affirming providers, people that understand the industry and its unique impact and having those resources available. Some diverse identity considerations. Sexual challenges are going to be faced uniquely by each individual, but we have done some research on how specific identities might be uniquely impacted or resources that might be unique for that population. So for queer clients, it's really important to seek information about like self-definition of sexual concerns. Like what really is the challenge, right? We make assumptions that when we hear sexual challenge, it means orgasm or ejaculation or interest, right? We make assumptions in these titles about what it means, but it's really important to give information about how do you define that sexual challenge for yourself. Assessing what is the preferred and affirming language surrounding these concerns and genitalia that might be involved or impacted, and accepting fluidity in those definitions and terms, and that may change over time. Equally important to consider, intersectional identities and cultural implications that may be at play. So we've got queer clients, but then we've also got queer clients that are facing intersectional identities related to race or socioeconomic status or religion. For kinky clients, acceptance of sexual preferences is key and the most important, right? Is that accepting that sexual preferences are unique to the individual. And at the same time, distinguishing between safe and unsafe practices by focusing exclusively on boundaries and consent, right? So what really determines if a certain behavior is safe or unsafe is our boundaries and consent be violated, not the practices themselves, right? So really assessing and making sure that there's psychological safety in these sexual encounters and not judging the practices themselves. Another thing that's important when working with kinky clients, or if you are a kink client yourself working with a sexual health provider, is assessing for control bias. So this is that tendency of individuals to believe that they have more control over a sexual experience than they actually do. So really assessing for like, this control that you're naming or this, emotional safety that you're naming in the relationship, is that really present when you do the assessment and get down to it, and assuring that everyone involved is engaging in kink in really safe and consensual ways. For lesbian and gay clients, really important to challenge heteronormativity. So this idea that like heterosexuality and penetration in one specific way is the standard. It's not for a lot of people. So people don't need to conform to traditional gender roles or relationships. So in this case, it's really important to, again, learn like preferred terminology, preferred practices, beliefs, instead of making assumptions about it. Similarly, for bisexual clients, it's important to thoroughly assess sex history, right? So, when and with whom and with what parts sexual challenges have been presented. So they may present in one dynamic and not others. It's important to get that assessment. And then challenge biphobia and stigma, this assumption that bisexual people are now straight when they're in a hetero relationship, really challenging some of those beliefs about when and how sexual challenges pose in bisexual clients' lives. For asexual or aromantic clients, it's again challenging these assumptions about asexuality, such as they've never engaged in sexual activity at some point or won't in the future, given the new fluid nature of sexual identity. For example, gray A, right? So some gray A folks might still experience sexual attraction rarely or at low frequency or only under certain circumstances. So not making assumptions that ace clients have never engaged in the past or consider engaging in any level of sexual intimacy or just relational interest in the future. Really important, ace people might still be in romantic relationships and have romantic discrepancies with current partners that pose challenges, may just not be in the traditional sense that we think of sex. For trans clients, important again to thoroughly understand one's identity, intersectional identities, and specific vulnerabilities that might be at play during sex and intimacy. Important to challenge assumptions that there's only one way to be trans, that it's sort of like you go from one binary to another binary. There's lots of, different identities at play. And then not making any assumptions about surgical preferences, making assumptions that someone experiences dysphoria of all reproductive or genitalia. So really just understanding that person's unique experience, where do sexual challenges show up, with whom, and with what parts. Lastly, for non-monogamous clients, polyamorous clients, whatever terminology you prefer, it's similarly important to allow for self-definitions, right? So not all existing labels fit everyone all the time. Relationship orientations can really change depending on the dynamic you're a part of. So challenging the assumptions, that one partner is always in control of the sexual choices, that kink is always assumed in non-monogamous relationships. So understanding that some of these assumptions apply to some couples, but not all. And it's important to negotiate rules and agreements. So sexual violations can still certainly take place in non-monogamous relationships that impact sexual functioning. And so you might be supporting folks as they're negotiating rules or agreements within that dynamic. Okay. So before we wrap up, I do want to provide a practical tool for folks tuning in, folks that are working with folks in this space. And this tool is called Sensate Focus or Mindful Touch. What this is a cognitive behavioral approach. So again, focuses on the way that we think and the way that we behave, that incorporates education about sexual responses and a series of like incremental small physical exercises performed in the safety of one's home, right? So the reality, if you're doing sex therapy work with, a mental health provider or a medical provider, you're not able to engage in some of those exploratory exercises that you need to in the office, in the exam room, in the therapy room. And so it gives you these gradual exercises that you can engage in the safety of your home. Purposes or aims of this is to promote relaxation, effective communication between your partners, really enhance attention to physical sensations rather than these goals or these outcomes, and promote physical and emotional connection between sexual and romantic partners. So some of the functions or the purposes of sensate focus and mindful touch are, to help partners become more aware of their own sensations of arousal rather than focusing solely on pressure to perform sexually or an outcome, right? So really being in tune to our own sensations, needs, desires. Also allows us to focus solely on our own needs for pleasure versus solely pleasing the other partner. So often sexual challenges present because we're ignoring our own sexual needs and thinking only about pleasing the partner. This allows us to slow down and really become in tune with our own desires, sometimes for the first time for people. Allows for that communication of those sensual and sexual needs, wishes, desires effectively with our partners because it's built in. It creates space for that communication that often isn't present in sexual dynamics. Through that process helps us really increase awareness of our own partners or partner or partners' sensual and sexual needs. So again, there may not have been room for those conversations in your dynamics in the past. It really slows down and allows us to understand both our own needs and our partner's needs. Importantly, it expands the repertoire of intimacy, right? So when we hear intimacy, we often think sex, and it expands what that might mean. So, any kind of touching, sensual, or sexual behavior, sex is not just intercourse. It can be all these different things. On that note, it really helps us to learn to appreciate things like foreplay or touching as an end itself rather than a means to an end. So again, we often think about foreplay as what we do first, and then we have sex, right? Or then we have penetration. Sometimes foreplay or touching might be all that needs to be present in a sexual dynamic in certain circumstances. Ultimately, the functions are to create more positive sexual and relational experiences. It can create more closeness and trust and intimacy with partners, can build that sexual desire back in relationships that might not be present anymore, and enhance the level of love, caring, commitment, intimacy, cooperation, and sexual interest. And so the goal isn't necessarily let's have more sex or let's have more penetration. It's let's re-envision what does sex and intimacy look like within the context of the relationship that you have. So if all of that sounds great for you, a couple things you would want to do first before incorporating this into your dynamic with your partner, your partners, or yourself, right? Assess readiness of both of yourself and the couple or their dynamic. So use of sensate focus, it's a tool, right? It's a thing you might incorporate, but it does require motivation, a positive attitude for it to work. So if you're not bought in, if it doesn't feel right to you and your partners, it's probably not going to work in the way that it's designed. So remember, keep in mind, these are structured exercises with several small and graduated increments that are really specific to the needs of the couple. So I will present like what theoretically the steps would look like, but understanding that maybe the timeline or the steps are going to look really different for every couple, and it's not a prescription. It's not a specific timeline or activities. You've got to determine that for yourself and your couple. Proscribing intercourse. I think in like the myths of sexual therapy is that like all sex therapists do is prescribe sex and like you have to have sex. It's actually the opposite. And so this specific strategy recommends that you avoid full penetration and intercourse in any activity that is sexual to remove the demand. So we actually take a step back and we do not have sex for a period of time with the goal of getting back to a place that sex is healthy, an intimate and positive experience. So you proscribe rather than prescribe intercourse in this activity. And that creating sensual environments is really important, right? And so sometimes sex can feel really pressured and rushed. We can take out all the intimacy. And so I really encourage people in couples or, thruples, whatever it might be, to, be creative in creating these environments for themselves. So you might want to ensure it's a private space, relaxing, might be outside of the bedroom, right? To start with, music, candles, lighting, all these things can be really important. Use of food or tools or toys, those kind of things can be important too. Key of sensate focus is that timing and giving and receiving are really important, right? So this should not be like hours long. That adds, again, a lot of pressure. It might more reflect dynamics where sexual challenges are presented. And so the recommendation is it's usually 10 to 20 minutes of practice, right? So you set a timer and it's a specific amount of time. Takes away the requirement that there's any kind of an outcome or a goal, right? You're not trying to achieve something. You're just trying to use that time effectively and build some intimacy. To start with, it can be good to prescribe a frequency in a week. So maybe one time a week you engage in this, 3 times a week if you already feel a little bit of advanced, 1 time a month, right? It just depends on your own needs. But what is important in that 10 to 20 minute practice is that there is designated time for giving and designated time for receiving. So again, you're not focused on a certain outcome or goal. It's you're focused on that one individual, their needs, focusing on that time, and then you may switch to the other partner, want some, equity in it. During that time, really important to focus on the sensations, the positive thoughts, the fantasies, what you feel, not what you should think you should feel, not what you think you should achieve, but just being really present in the moment and mindful. Concentrating again with that mindfulness on your current sensations, not any goals or outcomes. So in sensate focus, orgasm is actually never the goal. If it happens to happen, great, right? But that's not the goal. It's current in the moment sensations. In this process, couples or thruples or individuals engaging in masturbation might find themselves having heightened anxiety or fears in those moments. You might notice that these thoughts are coming into play because it's sort of unnatural to really focus on yourself or create that kind of intimate environment. So it allows an opportunity to practice how do we interrupt and replace some of those negative judgments and thoughts with positive observations as they arrive in the moment. Now, as I mentioned, key here is with these steps is it's really got to be unique to you. You have to decide where you start and how you progress, but generally it is a 3-step process. Starting with step 1 is our touching and our sensual pleasure. So this is solely touching for interest and curiosity. It is not inherently sexual. things like cuddling, holding hands, massage. And the idea here is for step one, again, we proscribe intercourse, no intercourse, is that you must progress to like full body genital, non-genital massage or touching in a mindful way before moving to step two. Now, you might be a couple that already does this really well, right? And you can go to step two pretty quickly, but there are a lot of folks that are in relationship dynamics where the idea of even being present in a room together feels really difficult. Sitting on a couch together, cuddling, holding hands, maybe hasn't been present in your relationship for decades, right? And so, you can't judge anyone else's relationship, but there are couples that need to start at the step one and just be present in a room together. The goal is you must then progress to the full body non-genital massage before moving on to step two. Step two is our sensual pleasuring with erotic stimuli. So this includes, breast, genital stimulation, focusing solely on pleasurable sensations, not an outcome, not orgasm. The idea here is that you must be able to engage in, touching, genital massage, just being kind of erotic and intimate with each other before you transition to anything that looks like intercourse, right? So we ask that folks successfully engage in several positive trials of step two. So being able to touch and explore kind of with interest and curiosity in a sexual way with partners before we ever get into a place of intercourse. This one can take a lot of time. People might stay present in this one for quite some time before they'd even consider intercourse. For things like genital pain and pelvic disorder, this is one that couples often do have to spend a lot of time on step two before we consider intercourse, because that intercourse is really what promotes the pain and the fear and the anxiety, right? And so you and your partners need to be checking in with each other and communicating on, how much time do we need to spend here before we go on to step three? And it really has to be a mutual decision. So it's not uncommon for maybe one person in the dynamic to be ready to move on to another step while someone else isn't. It really has to be a mutual decision, and all partners have to be ready and willing. Step three, again, can take usually more than days, but weeks, months, years, right? So we get to step three, depending on how long the sexual challenge has been present, how many different things are at play. But step three is our intercourse, right? And so when I'm posing this to people, the reaction is like, you're telling me not to have sex, right? Like the goal is for us to have sex. The goal is still to have sex if that is what your goal is. If your goal is to return to intercourse, then that is the goal. And the idea is that engaging in these steps and taking that a step back from that is ultimately what allows us to re-engage in intercourse in more healthy, in intimate ways in the future. So once we get to step three, this is an intercourse, and again, like gradual steps. So might start with running genitals together, shallow penetration, penetration without thrusting or orgasm, and then ultimately full penetration. So, these steps, again, step one, two, three, really unique to each individual and all relationship dynamics, and you and your partner communicate together about when you go on to those other steps. If you're looking for more information about sensate focus or mindful touch, there's lots of good resources online. And this work can be done really, really well with a couple of relationship therapists, right? And so we have a lot of folks that are working with couples who maybe are part of the adult industry and navigating sexual challenges in that space. A lot of couples that work with those who are experiencing, challenges within E&M, right? So ethical non-monogamy. And so maybe it's present with one partner or not, or communication to things like that. Lots of folks that are really affirming an understanding of all the different relationship orientations that might be out there and how sexual challenges might be embedded in them. I have done this with individual folks in therapy, so without having to invite a sexual partner and then bringing that back and communicating with the partner, that's okay too. So that could be a space, right? Like you work with a pineapple support therapist and you bring up to them you're experiencing this sexual challenge and want to work on sensate focus or mindful touch. That's work you can do individually as well. Wonderful. So thank you again for joining me, Dr. Tess Kilwine, during today's Pineapple Support webinar on sexual challenges, root causes, and how to overcome them. Experiencing sexual challenges personally or professionally can adversely impact one's well-being. This webinar reviewed the different types of sexual challenges, root causes, and how to overcome them. Barriers to overcoming sexual challenges and how diverse sexual and relationship identities are uniquely impacted was also covered. We will now open it up to questions. If anyone who's present live would like to ask any questions, feel free to put them in the chat. Seeing none, thank you all for being here. This webinar was recorded and will be posted for folks to watch later in the near future. Take care.